Hi, good afternoon. So first slide, Erin. Erin's navigating the slides there. And this slide seems really basic probably to our public health partners, but I think it's important to understand the challenges we faced and the progress we're making in medical settings for the medical community to understand or acknowledge that healthcare or health is only a small part of the total health picture. There's so many other things contributing to health. And I think it's been a real cultural shift here, at least at Children's Hospital, to start integrating social determinants of health into the understanding of what health is. And as Kylie pointed out earlier, a lot of navigation teams are focused on disease conditions. How can they work with families on asthma, cardiovascular disease, diabetes? Our model is strictly looking at addressing social determinants of health as part of the healthcare picture. So, next slide, Erin, thank you. So we started out in 2016 with 3 distinct projects. One, looking at ED utilization. How can we work with families to enhance their clinical care, providing supports for social determinants of health, thus reducing ED utilization. And we had 2 navigators in low-income pediatric practices in Colorado. The next project we felt was really innovative. It was looking at partnering with public health and placing navigators in a WIC office here in Colorado in a high-need area. And the third project was looking at working in our community health clinic, administering a screener and having referrals go directly to navigation to address social determinants of health. So we started with 6 navigators, 3 different projects. Next slide, Erin. So, and since January of 2016, we've grown from 6 navigators in 3 settings to 12 navigators in 9 settings. It has been a great experience to watch the integration of this new team into the care coordination model within the medical setting. In 2018, we had 11 navigators provide support to 5,000 families in those settings, primarily financial assistance, benefits assistance, food insecurity, and assisting in finding primary care providers. You know, and I think that's an interesting thing that we didn't anticipate as being a top need, is if the child is coming in for well child checks and the parent does not have a primary care provider, how does that impact the total health of the child? And we were just intrigued by how many parents do not have health care themselves. And if we help parents provide access to health care for them, does that change the health of the child? So, next slide, Erin. So where do we go next? I think we've successfully integrated the navigators into the healthcare system, and I can't say it was not without challenges. There were a lot of pushback initially about hiring people from the community. How would those individuals integrate into a medical setting? I was asked questions like, do they know how to make decisions? How are they going to work with someone and advise someone and support them when they're community members themselves? So I think we've overcome that. They're now considered indispensable to the healthcare team, but it did take a lot of work. We are expanding into a school-based health center in a low, high-need neighborhood here in Aurora, and we're expanding into an elementary school this year. The other thing we're doing is we know and we're documenting who our partners are. So who are we referring to, and how can we work with those partners to enhance services to our families? The other challenge, and something that we're working on continually, is what is the evaluation criteria for this program? I think if you have an asthma-based program, a diabetes prevention program, I think you can measure outcomes. You can measure how often they go to the doctor, how often they go to the ED. But it is a challenge when you're addressing social determinants of health to determine if you provide housing support, does that have any relationship to health outcomes? Or do you need 10 years to prove that? So we're really struggling with that. We're also using two different data collection systems. We're using a community-based data collection system for our navigators in WIC and in the pediatric practices, and then we're using EPIC in the clinical settings. And then fourth is, how do we address this and how do we look at a value-based payment model here in Colorado? So Kylie, I will be calling you about how you accomplish that. So I feel that it's been very successful in Colorado, and it continues to expand in all types of settings. So that's it.